Hello, everyone, and welcome to this episode of Power to the People, sponsored by the Paducah McCracken County NAACP. I'm your host, Corbin Snarden, and we're so happy to be able to bring this episode to you today. And we're talking about healthcare today. Things are a little bit different. We're not in the TV studio at this episode. Due to the pandemic, we're bringing this episode to you via Zoom, but we are so happy to be able to continue in this format, giving you the information that you need to empower your community. Today, we have three very special guests who are all experts in their field. And we're going to have a very candid conversation again on healthcare. So we have with us today Miss Brandy Harless, who is the CEO and founder of Prevent Scripts. We also have Dr. Jenny Franke from Mercy Health Lourdes Hospital, and we have Mr. Terrence Adams, Director of Orthopedics and Neuroscience from Mercy Health Lourdes Hospital. Thank you all for joining us on this episode today. So I want to go ahead and get right into what we're talking about, healthcare and healthcare disparities. One of the trademarks of the NAACP in our vision is to actually fight for the equality and ending race-based discrimination in all forms, and that does include healthcare. I want to start off today's episode by just talking about some disparities and some statistics that are going on in healthcare and seeing how we can affect change in these areas. So according to the CDC, and I've got a few notes here in front of me, premature death rates are higher in Blacks and Hispanics than any other group. Also, drug-induced deaths are the most highest in American Indians and Alaskans, people of color in that category. The infant mortality rate is double for Black women than it is for white women in the same category. We also see that there are higher rates of diabetes in people of color, specifically Black males. Let's see, recent data by the CDC says that Hispanics and Black Americans are more likely to be uninsured. In fact, up to a quarter of African Americans are uninsured, and up to 20% are uninsured in Hispanics in terms of healthcare insurance. And the highest rating of poverty included in the healthcare sector is amongst Black and Hispanic adults. So those are some very startling statistics that came from the CDC, notwithstanding that, of course, we are in the middle of the pandemic with COVID-19. We see that African Americans and other people of color are often having lack of resources to the proper preventative treatment and care of COVID. Also, they are receiving the vaccine at lesser rates, according to CDC data. So I'm going to open the discussion kind of right there. I know that's some very startling statistics, but I would like to start by just opening the question with, why do these healthcare disparities exist? Shouldn't the healthcare system be equal for all of us? Does anybody want to start the conversation off?
Sure, I'll jump right in on that one, Corbin. Thank you for posing that question. This is a topic that we keep top of mind here at Bon Secours Mercy Health. And as we look at health disparities, we have to also understand that there are different types of disparities, right? So there's institutionalized disparities, which is the access to goods and opportunities, services are limited due to diminished or racial codifications. Internalized disparities, messages of the marginalized racial group about their own ability, value, and worthiness. Then there's also individual disparities, prejudice, discrimination, bias about the intentions, motivations, and actions of others. And with all these disparities, as we look at the healthcare system, we have to think about the broader social and economic inequities that we have, because those factors drive our health outcomes. So we think about economic stability around employment, income, the neighborhood, physical environment, education, food, community and social context, and the healthcare system overall. You spoke to some of those things as far as health coverage and insurance coverage. All of those things impact our health outcomes, as well as racism and discrimination. All of it is interconnected, right? And so those health outcomes we're talking about is mortality rates, morbidity, life expectancy, healthcare expenditures, health status, and functional limitations. So all these things are connected. And as we look at the connection between racism and health equity, we got to think about law enforcement, with policing, banking, as we looked at banking and redlining, right? And banks disproportionately steering Blacks and Hispanics into subprime loans. when they qualified for conventional loans, leading to racial inequalities and foreclosures during the mortgage crisis. Well, if African Americans and Hispanics are not living in those communities that have better education, better infrastructure, and better access to healthcare, those social economic factors impact their health equity and their health outcomes. And so you talked about vaccines and COVID-19, the current pandemic we're in. Black people have died at 1.5 times the rate of white people. Um, we do suffer from high blood pressure, diabetes, and stroke, and things of that nature at a higher rate compared to our white counterparts. And infant mortality rates are very high. I mean, I think it's 10.8 for black people and 4.6 for white. So at that double rate that you mentioned earlier, that those numbers are legitimate. There are some things that impacts us in how we approach healthcare for blacks in from our perspective as healthcare providers. That we have unconscious bias in healthcare, that racism and unconscious bias impacts that. You have members of minority groups tending to receive lower quality care. African American children with acute appendicitis are less likely to get painkillers in the ED. Women presenting with CHD symptoms are significantly less likely to receive a diagnosis, referral, and treatment. All these are studies that have been researched and kind of show the impact of what these racial disparities do for us, and how racism and all of that impacts us, right? And so African Americans don't trust the healthcare system. We don't trust the healthcare system mainly due to the Tuskegee experiment. Everybody knows about that, the study of untreated syphilis in the Negro male. Well, with that, recent research shows that African American men are with higher medical mistrust more likely to delay preventative screenings, as well as they have African Americans with hypertension have lower medication adherence due to mistrust of their physicians. And so, last thing I'll close on here is that it's important that we understand and recognize how racism and discrimination, bias, and trust contribute to the non-compliance of medical treatment and medication, delay of care, access of care, social determinants of health, as well as how it impacts the individual health outcomes, our health experience, and overall health and well-being for generations to come.
Okay, thank you. You mentioned a lot in a little bit of time right there.
Yeah.
And I want to pose a question to Ms. Harless, and Dr. Franke, I'm coming to you to talk about COVID in just a moment. But Ms. Harless, you have your own healthcare company. And if you wouldn't mind just sharing a little bit of what your company does, but also maybe jumping into some of the disparities that Terrence was talking about. Is that your experience in your profession?
Yeah, well, I appreciate that. So just really quickly from a company perspective, what we're doing is building a prevention service line to embed into primary care physicians' offices. So our whole vision is to capture at-risk patients prior to being diagnosed to disease that are preventable. We do that through partnering with primary care providers. So our vision is to utilize that primary care system to identify those people who are at risk. Now, what Terrence mentioned is very important, and that is the rates that most African Americans seek care is significantly lower than their white counterparts. So that is a big issue, a big barrier. I'll tell you, I am spending a lot of time lately in the startup digital health world. So people who are building new companies around some of these really big problems we have in healthcare. And there is a new company, it's not actually new, they just raised a whole lot of private investment to expand, and they're up in Brooklyn called City Block. And what I love about their model is that they have basically said we have to be in the neighborhoods on a granular level to help to overcome those barriers of access to care. If you think about the conversation we're having in America about policing, and we want all of our police officers to be community-based police officers, which means they need to be in our neighborhoods, meeting and getting to know people, we need to take that same approach to healthcare in a lot of ways. And that's what City Block is doing, because you overcome those challenges that Terrence mentioned with trust. There's no magic formula other than that. Trust is the answer, but trust takes a long time to develop. Now, I have happened to have the honor and privilege to serve our community in elected office over the last couple of years. And I, before that, actually helped to found the Healthy Paducah Coalition and also helped to bring in Kentucky Care to Paducah, which is a federally qualified health center. And one of the reasons why we did that early on was because we recognized that at that time, we didn't have enough primary care physicians to take care of our population. The good news is that along with Mercy, expanding primary care, Kentucky Care, Baptist Health, there's been a lot of work gone in to making sure people have access now. So when that person makes that decision, I'm ready to access primary care, we no longer in Paducah necessarily have the barrier of access to the service. I think we still have the barrier that Terrence mentioned, which is some of those perceptions and fears that are based around our history. So I'm with him. I want to add on top of that, Terrence mentioned social determinants of health. And those are really, I think, I'm thankful that the healthcare system as a whole, but especially public health, has been thinking about the social determinants more now than ever, because we used to only think straight line. The healthcare system was the answer. We kind of thought about public health. We've seen with COVID how important public health systems are, but how limited they are in America. And we have a lot of work to do, I believe, to reform the public health system here in America. But the social determinants piece is so key. And that's where everyone in our community has an opportunity to impact, because we're talking about housing and transportation. We're talking about access to physical activity. We're talking about things that our entire community can get involved in order to support and to solve some of these issues we have. So we don't just have to look to the healthcare system anymore on their own. We can now participate as community members as well in being part of the solution.
Yeah.
Thank you, Ms. Harless. So, you mentioned COVID-19 and the lack of trust that was both mentioned by Terrence and yourself, and social determinism. Dr. Franke, as the Chief Clinical Officer at Mercy, you have a responsibility in coordinating vaccination responses. Would you like to enlighten us a little bit more on the vaccine? As Terrence mentioned earlier, that COVID is killing African Americans at a rate that is higher than other populations, and there is a lot of mistrust going around about the vaccine and in minority communities for many different reasons. I know Terrence brought up the Tuskegee experiment, but would you like to shed a little bit of light on that, please?
Absolutely. Corbin, I think there are two main issues. One is getting education out so folks can make an informed decision. And the other, of course, as everyone has indicated, is access. And access is not equal for all people. You can't just say, because we have open appointments for vaccination, everybody has access to receiving a vaccine. Some vaccines, folks get online to schedule. Well, if you don't have that technology, if you don't have that knowledge, if that's not a skill set that one has, then you don't have access to a vaccine. So we have to tackle that aspect of things, in addition to the information, the education, and that hesitancy that some folks have about this process. So here's an example. Within our associates, Mercy Health associates, approximately 53% of Caucasians have been vaccinated. 32% of our own African American associates have been vaccinated. So this is a group of folks that presumably have had similar access, similar information given from a corporate standpoint, but still have a hesitancy to trust the vaccine, to trust the system. And so I'd like to spend a little bit of time on that information, if that's okay.
Yes.
When we look at the hard science surrounding the vaccine, the Pfizer and the Moderna are the two that are available now with an effectiveness of over 94 to 95%. That's an amazingly effective vaccine. So that's one statement that is hard science that we can share with the public, is that these vaccines are very, very effective. The side effects tend to be mild and similar to flu vaccines. Maybe a little fever, a sore arm, a headache, some muscle or joint aches are the most common. And those are actually signs that our body is responding to the vaccine our immune system is mounting a response to fight the vaccine, it's not a sign that we have gotten the vaccine. So an important point for folks to understand is that receiving the vaccine does not give us COVID. And the chances, the incidence of severe reaction are very, very low. So as it relates to safety and effectiveness, we have that information there. There are a few myths that have been surrounding the vaccine, some of them that we see on social media that we sort of have to overcome. This vaccine does not get into our own DNA, our own genetic material. It does not cause us to develop a mutation. It does not give us cancer. It does not cause, as far as science can tell, birth defects because it never gets into our own DNA. Important points to understand. When I have looked at our access in general at Mercy Health for the vaccine, we've chosen to use a telephone process for scheduling. We do that because the vast majority of folks have access to a phone. It's nice to be able to have an online platform. It's nice to be able to use MyChart or another option. But we know that folks that are particularly motivated and particularly tech savvy are going to gobble up appointments awfully quickly, and we don't want that to happen. We want to make certain that we have access to folks across that socioeconomic demographic, and we're working hard to make certain that our primary care doctors know if they have a patient who's having difficulty getting an appointment, they can call us, we can put them on a list, we can call them at the end of the day if there's extra vaccine. We have ways to accommodate those folks that are high risk that need to get in and have barriers to communicating and scheduling. So a lot of work to be done. I think it's important to understand that the healthcare systems in Western Kentucky have stood up this vaccination process in a very short period of time. Have we done it perfectly? Probably not. Have we done it with good intentions? We really have. We still have some work to do to communicate and open up. And if we can't find a system that brings perhaps some vulnerable populations to us, then we need to get the vaccine to those folks. And we are working actively with the health department to develop programs to do that.
Thank you, Dr. Frocke. And I definitely want to say thank you to all of the healthcare workers and employees and providers that may be listening to this, and everyone who's on the call today. Just want to make sure to give them a big thanks because hospitals have had to go above and beyond in this time period, and it is not easy to coordinate a vaccination effort this large. I don't think that at least in modern history, we have ever had a vaccination effort this large, this fast, this quick, and having to adapt to that. So it is certainly challenging. I want to go back to Ms. Harless and Mr. Adams here in just a second to pose the question of this. You mentioned, Ms. Harless, preventative care, and that, of course, we do know that preventative care can actually help you not go to the hospital, actually keep you healthy and keep you in a condition where you may not need as much serious care from hospital providers, which is actually a good thing. But when we talk about this as well, we also know that especially in impoverished communities and particularly communities of color, that sometimes this preventative care is a little bit harder to get to or a little bit harder to access. What are some preventative methods that people can work towards if they are falling into these communities?
Oh, I'm first. Yeah. I had to remember, did you call me first? Well, here's the deal. I mean, I think that at this point in our knowledge base, we understand that the discrepancies are real. Sometimes you have to get a little bit more granular to truly understand what the real issues are and why there are barriers. So for example, I think one of the things that we're really struggling with and lacking, especially in Paducah, is really census level understanding of our communities. We have great county data that shows us some issues around, diabetes prevalence, smoking prevalence, those kinds of things. But we haven't quite found a way, and really this is a national problem, not a Paducah problem, but we don't really have that good census level understanding of where are the pockets of issues. And it goes back to the social determinants of health thing for me, right? Because you've got to holistically think about an issue like obesity. If you're thinking about people who are overweight, we know that there's a discrepancy. I think in Kentucky, actually, the group in the Foundation for Healthy Kentucky did a lot of study on this. The group they called multiracial population are the ones experiencing obesity at a higher rate. And so when we think about that, we have to ask ourselves, what kind of prevention interventions do we have and are needed from a social determinants of health to help someone overcome obesity or prevent obesity in the first place? These are things we all know. We know that we have to move our bodies. We know that we need access to healthy fruits and vegetables. I think people are kind of tired of talking about that in some way because it feels like it's not profound anymore. But the truth of the matter is, those are still things we know in the public health community and medical community that can prevent disease. They don't sound profound on the surface, but they are when you talk about the fact that many of our census tracts here in Paducah are food deserts. People don't have access to healthy fruits and vegetables. If you remember back in the day, there were corner stores. Some neighborhoods and some cities have been able to leverage the corner store to provide healthy fruits and vegetables to neighborhoods because people can walk to those stores. Now our corner stores, if we even have very many in Paducah left, are full of junk food and alcohol most of the time. So we have a food desert issue here in Paducah. There's no doubt about that. So we also have a physical inactivity issue, I believe, in Paducah. And when you think about the neighborhoods where people that are usually experiencing some of these discrepancies, there are less parks available for those people. The sidewalks are in horrible shape. They can't get out and just go for a walk safely with their families or for themselves. They'd have to drive somewhere in order to do that. So when it comes to prevention, we have some environmental barriers for sure in our community. And I think your direct question was, how can people do prevention efforts? But I guess I answered that question like roundaboutly because I want to say, let's all get out and walk and let's all eat healthy fruits and vegetables. But the truth of the matter is, it's not easy, especially in our community. It's not easy. So we have some work to do in that regard. And I think that there are efforts in place, but we've got to turn up the heat, I'd say, to make a true impact.
Yeah, thank you. So Mr. Adams, we got about 5 minutes left, and I definitely want to come to you to pose this question. So in communities of color, what can communities of color do, or what would you encourage them to do, in terms of seeking equity in healthcare, in terms of, improving their overall health conditions?
Yeah, Corbin, thanks. I think it is very important that we connect with the primary care provider. They are basically the gatekeeper of our healthcare, right? And so they're going to connect us and ensure that we're getting the proper screenings, that we are, leveraging our labs to in testing to ensure that, we don't have any type of genetic issues or predisposed issues from a, from a lineage standpoint, a family history. I know I have heart disease that runs in my family. So my primary care provider understands that and is going to monitor those things for me as I meet with them annually. So it's important that we're getting those things done. It's important that we're also taking care of our dental hygiene and ensuring that we're going to the dentist twice a year to get our cleanings and checkups done, and meeting with that primary care physician and getting that physical done every year, getting our screenings done at the appropriate age points where we're, if it comes to, breast screenings, mammograms, colorectal screenings, getting our colonoscopies and all these other different things, prostate, all these exams completed on a regular basis. We look at the Black Panther, he died at 40, at 43, 44 years old from colorectal cancer, and he hadn't even reached the threshold of getting the screen. of what's recommended. And so is it always recommended for African Americans to do that at 50 years of age? Maybe because we suffer from colorectal cancer at a higher rate, we should probably be looking at it a lot sooner. And definitely if it's something that is prevalent in our family lineage, that, we should take a much closer look at that early on. So, ensuring that we're doing those type of things. I also believe that, as an African American, that it's important that we connect ourselves with a healthcare system that has the diversity, equity, and inclusion in their DNA, right? How does their leadership look? Do they have someone that look like you? Do they have people of color? Do they have diversity on their leadership team? Because those are the minds that are going to ensure that your quality of care is top of mind. And if the system is focusing on diversity, equity, and inclusion, they're doing those unconscious bias training with their employees. So when you encounter the ED, you're not looked at as a pain seeker, right? And there's more compassion, more care that you're going to be able to receive that'll be equitable for you. Also, they're going to be intentional about employing providers or physicians that look like you as well, in order to continue to build that trust. They're going to be out in your communities and doing things and bringing screenings to you, and meeting you where you are to ensure that you're able to access care and actually access the resources that you need in order to have live a better life and be healthy. And so I think it's important that we seek that out and that we do our research. Everything is on the internet today. You can look at what someone's organization's D&I strategy is, and I think if you looked at Mercy Health, you'll see that there's a lot of things that we're doing. Prime example, we've done the unconscious bias training, we've done racism training, we've moved our executive talent acquisition under the D&I umbrella to ensure that we are implementing the Rooney Rule, right, and ensuring that our candidate slates have people of color in those top positions, as well as for from the interview perspective, and that we're hiring them. We've put a KPI out there that ensures that we have leadership that resembles the communities that we're serving. And so I think as you look at an organization that are building those blocks and actually putting strategies in place to ensure that that's within our DNA, that's within our culture, you're going to get equitable care from an organization like that.
Thank you so much. Last question for Dr. Franke. If you would just take 30 seconds and just tell us, how can people, you mentioned that the vaccine can be, appointments can be made via phone. Would you like to share that information, just a real quick 30-second blurb?
Corbin, I'd be happy to. If folks call 1-866-624-0366, that's a number that allows them to schedule through Mercy Health. I'll add one other thing before I finish up, and that relates to what everybody else has talked about as it relates to equity and understanding and ethical practices. And that is that when Pfizer and Moderna did their studies, they knew at that point in time that COVID disproportionately affected African Americans, Hispanics, Native Americans, and made a concerted effort to be very intentional to include racial and ethnic diversity in their study participants. So when folks out in the community look at the information that's available from those companies, they know that it is safe across races and ethnicities. It has been studied for efficacy across those different groups so that they can feel comfortable that ethically the study has been done to promote safety amongst all those groups of individuals, and we know it's safe as well.
Thank you so much, Dr. Franke, and thank you so much, Ms. Harless and Mr. Adams, for joining me on the call today. I want to thank all the viewers and listeners and watchers of Power to the People. Again, I am your host, Corbin Snarden, with the Paducah McCracken County NAACP. Never want to miss the opportunity to say you should become a member of the NAACP. Make sure that you visit our website at paducahnaacp.com. Thank you for joining us on this episode, and we hope to see you again. Thank you.